Welcome, dear students. We are nowadays preparing for PPSC examinations, and the date of a test of mental retarded category has been announced, and that is going to be held in a couple of days. Hence, today we are going to discuss very frequently asked questions from the field of mental retardation. So take it as a guess paper. Here we go. The AAMR, American Association of Mental Retardation classification system for mental retardation has 4 levels: mild, moderate, severe, and dash what? Educable, profound, trainable, or multiple. The answer is B, that is profound. 4 levels are mild, moderate, severe, and profound. Next question. The term mental age was introduced by whom? Alfred Binet, Tolman, Kindergarten, or Wessler? The answer is A, that is Alfred Binet. Stanford Binet intelligence scale was developed in which year? 1905, 1906, 1916, or 1986? Correct answer is C, that is 1916. A compound of identifying a component of identifying a student with an intellectual disability usually includes IQ. Which IQ scores are more frequently used as a cut-off? 60 to 65 and below, 80 or below, 70 to 75 or below, or 50 to 55 or below? The correct answer is C, that is 70 to 75 below. Next is in DSM-4-TR. DSM stands for Diagnostic Statistical Manual. International disabilities are divided into a number of degrees of severity depending primarily on the range of IQ score provided by the sufferer. One of those is mild mental retardation, corresponding to an IQ score between what? 60-65 to 80, 45-55 to 60, 50-55 to 70, or 70-55 to 90? The correct answer is C, that is 50-55 to 70. That is the range of mild mental retardation given by DSM. In DSM-4-TR, intellectual disabilities are divided in a number of degrees of severity depending primarily on the range of IQ score provided by the sufferer. One of these is moderate mental retardation, represented by an IQ score between what? The correct answer is B. That is moderate mental retardation is between 35-40 to 50-55. Then again, what is the range of severe mental retardation represented by DSM? Which is the range of severe mental retardation? The correct answer is D. That is severe mental retardation is 20-25 to 35-40. That is the range given by Diagnostic Statistical Manual, Volume 4. Again, what is the range of profound mental retardation given by DSM-4? Which is the range? Correct answer is A, that is 20 to 25 and below. The number of chromosomes in human beings are how many? Correct answer is B, that is 46. 23 from male and 23 from female. The pair of chromosomes that determine the gender of individuals are sex chromosome, autosomes, X-linked chromosome, or all of these. Correct answer is C. X-linked chromosomes determine the gender of an individual. Significantly sub-average general intellectual functioning existing concurrently with deficits in adaptive behavior and manifested during the development period that adversely affects a child's educational performance is the definition of which of the following? Learning disabilities, dyslexia, anxiety disorder, or mental retardation. The correct answer is this is the definition of mental retardation, D. Testing accommodation for students with mental retardation may include which of the following? Dictating responses to a scribe, extending time to complete an assessment, having test items read to them, all of these. Correct answer is all of these. DASH is a developmental disability that significantly affects a student's verbal and non-verbal communication, social interaction, and educational performance. Autism, mental retardation, speech language impairment, or learning disability. The correct answer is autism. Autism is a developmental disability. Next question is, students with autism may have which of the following characteristics of communication? Attention focused on one topic only, use of limited gesture to supplement verbal skills, lack of eye contact, or all of these. The correct answer is all of these. Then, which is a developmental disability that significantly affects a student's verbal and non-verbal communication, social interaction, and educational performance? Autism, mental retardation, speech language impairment, and learning disability. The correct answer is autism. Students with autism usually have a number of language impairments. Two common language impairments are delayed volume and dash what? Fluency, echolalia, articulation, or dyslexia. The correct answer is fluency. It can be echolalia also. There is broad agreement that autism is caused by abnormality in brain development, neurochemistry, and dash. Environmental factors, refrigerator mothers, poor early childhood intervention, and genetic factors. Correct is D, that is genetic factors. Mnemonic strategies help students learn and retain information. Mnemonic strategies include which of the following? Keyword strategies, peg word strategies, letter strategies, or all of these? The answer is all of these are mnemonic strategies. A persistent pattern of inattention or and hyperactivity impulsivity that is more frequently displayed and severe than is typically observed in individuals at comparable level of development is considered which of the following? Learning disabled, ADHD, other health impairment, developmental delayed. Answer is B, ADHD. A persistent pattern of inattention or hyperactivity impulsivity that is more frequently displayed and severe than is typically observed in individuals at a comparable level of development is considered which of the following? Learning disabled, ADHD, other health impairment, or developmental delay? The answer is B, that is ADHD. According to American Psychotic Association, APA, a student must manifest symptoms of ADHD before age dash and the symptoms must persist at least dash months. 7, 6, 5, 4, or 2, 2, 5, or 10, 6. Correct is 7, the age before 7, and the symptoms must persist at least 6 months. Genetic factors cause ADHD in about that percentage in children and youth who experience it. 20, 50, 80, or 100. The answer is 80%. Fidgeting with hands or feet, leaning the seat, running or climbing excessively, and talking excessively are characteristics of which of the following? Hyperactivity, impulsivity, inattention, or misbehavior? Answer is hyperactivity. Blurring out answer, difficulty awaiting turn, interrupting or intruding on others are characteristics of which of the following? Hyperactivity, impulsivity, inattention, misbehavior, and the answer is B, that is impulsivity. Which of the following is an example of specific learning disability? Mental retardation, dyslexia, ADHD, autistic spectrum disorder. Answer is B, that is dyslexia. Which of the following is an example of an intellectual disability? Dyslexia, ADHD, mental retardation, or ASD? The answer is C, mental retardation. An example of a developmental disorder is dyslexia, ADHD, mental retardation, or ASD. The answer is autistic spectrum disorder, that is ASD. Which of the following is an example of a perinatal cause of intellectual disability when there is a significant period without oxygen occurring during or immediately after delivery? Anoxia, pronoxia, anaplaxia, or dysnoxia? The answer is A, that is anoxia. When an individual with multiple cognitive disabilities has extraordinary proficiency in one isolated skill, this is known as Rain-Man syndrome, Asperger's ability, intellectual isolation, or Savant syndrome. It is called D, that is Savant syndrome. A structured environment where a person receives training and works with other workers with disabilities on job is an example of a supervised job with job coach, on-the-job training, sheltered workshop, or a high school vocational education program for students with special needs. The answer is it is known as C, that is a sheltered workshop. Of children with disabilities, approximately what percentage are considered mentally retarded? The answer is B, that is 9.2%. Sidra has difficulty working independently. When asked to sit in her seat for a long period of time, she frequently gets up and sharpens her pencil, look at the window, and flip through the books on the bookshelf. She does poorly on repetitive tasks such as math drills and she rarely completes her homework. Sidra most likely has which of the following? The answer is she has attention deficit hyperactivity disorder, ADHD, attention deficit hyperactivity disorder. When teaching a child who is mentally retarded, a teacher should do which of the following? Repeat directions many times, provide abstract examples, set lower expectations, or give instructions only once to improve child's focus. The correct one is the first one, that is repeat directions many times. Which test is widely used to determine how well a student is doing academically compared to his or her same age or grade peers? Vinland Adaptive Behavior Scale 2, Scales of Independent Behavior Revised, Wessler Individual Achievement Test 2, or Stanford Binet Intelligence Test. The answer is Wessler's Individual Achievement Test 2. When using direct instruction to teach students with intellectual disability, what is the correct order of level of difficulty that should be considered in teaching as to students? Recall, recognition, rehearsal. Recognition, recall, reconstruction. Recall, recognition, reconstruction, or recognition, reconstruction, recall. The correct is recognition, recall, and reconstruction. Which term refers to extra cues designed to increase the chances of a student providing the correct answer to a question? Brainstorming, prompt, suggestion, or none of the answers are correct. The answer is B, that is prompt. Which term refers to extra cues designed to increase the chances of students providing the correct answer to a question? Brainstorming, prompt, suggestion, or none of the above are correct. Prompt, this slide has been repeated. Maryam has a mental age of 5 and a chronological age of 10. According to Stern, her IQ would be, the correct answer is high IQ would be 50. First one. Why is Stern's traditional concept of IQ, which incorporates mental age and chronological age, no longer used? It has little reliability. It is not very useful for assessing the intelligence of adults. It is not very useful for assessing the intelligence of children. It is too controversial. The correct answer is C, that it is not very useful for assessing the intelligence of children. Which of the following statements concerning mental retardation is true? Profound mental retardation runs in family. Profound mental retardation does not run in family. Genetic abnormalities account for a majority of all mental retardation cases. For most cases of mental retardation, a clear biological cause can be found. The correct answer is B. Profound mental retardation does not run in families. That's all. See you in the next video. Till then, stay blessed.